Hello guys, welcome to my channel Ayush Health. In this video I'm going to tell about the inflammatory bowel diseases. The term inflammatory bowel disease is commonly used to include two idiopathic bowel diseases, Crohn disease and the ulcerative colitis. Crohn disease is an idiopathic chronic ulcerative commonly occurring through the any part of gastrointestinal tract. Terminal ileum is basically involved. Ulcerative colitis is a form of acute and chronic ulcero-inflammatory colitis occurring mainly in the descending colon and sometimes the large bowel. Inflammatory bowel disease is a group of inflammatory conditions of the colon and the small intestine. Crohn disease and ulcerative colitis being the principal types of the inflammatory bowel diseases. Both these disorders primarily affect the bowel but may have systemic involvement in the form of uveitis and spondylitis and others. Now we will talk about the etiology. Etiological factors include the genetic factors, 3 to 20 times higher incidence of occurrence, immunological factors in which immunological factors like the model studies transgenic deletion of molecules responsible for T cell recognition and others. Microbial factors includes the bacteria like Mycobacterium, Salmonella, Shigella, Helicobacter and others. Environmental factors includes the long-term administration of NSAIDs, psychosocial factors, smoking, oral contraceptives and others. Now we will talk about the pathogenesis of how inflammatory bowel disease is occur in the intestine. Inflammatory bowel disease is of two types, Crohn and ulcerative. It has two sides as you can see in the image. In Crohn disease, basically the ascending descending is involved, and in ulceratives only the descending is involved. Now we will talk about the pathophysiology of the IBD, its triggering effect, dysregulated inflammatory and immune response in genetically susceptible persons, amplification of immune response, release of inflammatory mediators, mucus breakdown and continuous exposure to lumen, dietary or bacterial antigens, impaired handling of microbial antigens by the immune system, inflammation. If the release of inflammatory mediations, release of the alpha pro-inflammatory interleukins, then mucus breakdown and continuous exposure to lumen, dietary or bacterial antigens can happen. As you can see in the image, there are two types of surgical removal of the intestinal part is done. First is the Crohn disease and the ulcerative colitis. The last treatment would be surgical removal of the part of intestine. Mesalazine, also known as mesalamine or 5-aminosalicylic acid, is a medication used to treat inflammatory bowel disease including ulcerative colitis and Crohn's disease. It is generally used for mildly to moderately severe diseases taken by mouth or rectally. It's the first line of treatment only basically for the Crohn's disease. So you can see in the image, this is the image of the mesalazine tablets available in the market. With this, I would like to end my YouTube video today. For the rest other videos, do subscribe my channel for more such videos where you can watch all disease, medicines and other reviews. Thank you.